Our Rise Above series has been sharing with you inspiring stories of everyday people doing incredible things in rising above life's tough obstacles. The series is in partnership with the Fresno Heart and Surgical Hospital, and the vision for the Rise Above movement was started by the program director for the hospital's metabolic and bariatric program, Dr. Kelvin Higa. Our Stephanie Bainham sat down with Dr. Higa to learn more.
Today we are celebrating the spirit of Rise Above, and someone who knows that very well is the director of the Fresno Heart and Surgical Hospital's bariatric program, Dr. Kelvin Higa. Doctor, great to have you on today.
Well, thank you.
Let's talk about Rise Above, because this has been the soul of your hospital for a long time.
Yes, you know, it's a very interesting phenomenon that took place. We were discussing the journey of our patients and how much adversity they had to overcome and where they came from, where they got to, and we decided it was very compelling, all their individual stories. And the name Rise Above sort of came out of this discussion.
And so with everyone out there, I think a lot of folks can relate to it because everyone goes through hardships.
Absolutely. Everybody has a story, and whether that leads them into the limelight or whether it just affects their family and personal life, it's always a great story.
Yes, it is. And I know you've met many wonderful patients. Can you talk about your experience?
Well, all my patients are wonderful, and every one of them has such a compelling story. I guess it's the reason why an individual might want to go into medicine for the first, just to help people, but then to really see that you can actually help them on many levels, not just the health, but their lifestyle, their interactions, their work, and it's really more than I'd ever thought about, at least when I decided to go into medicine.
Because it's such a journey, isn't it, doctor, when one chooses to go through bariatric surgery?
Oh, absolutely. You know, there are so many barriers to getting patients to proper care. First, there's that underlying, we call fat bias, that individuals of size, it's their fault. And then it's not really a disease. And in all the literature, all of our studies show exactly the opposite. And so even insurance companies put huge barriers in front of patients. Imagine if someone had breast cancer and a patient were told, well, it's your fault and we're not going to treat you for 6 months to a year. And how would that make you feel about what you have to accomplish? So patients endure that.
Yeah.
And we help them through that process.
You sure do, and you really help them rise above. And tell us about your bariatric program, because I understand it's one of the busiest and one of the best in the whole country.
We're very proud of our program, not just because we do more operations than anyone else in California, and our quality is, by all our metrics, is very good and outstanding. It's that we're able to bring this technology and these services to everybody, not just the elite few, but for public insurance for everybody, and we can do so and become a resource for the entire Western United States.
Yes.
So we don't turn anybody away, and in fact we reach out to anybody who's had surgery anywhere, by anybody. If they have an emergent problem, we will accept them in.
And Dr. Higa, I gotta ask, do you have a Rise Above story?
I do. I have a personal Rise Above story. My story really begins in childhood when I was very young, and I was considered to be overweight, and so much so that I was bullied and teased in school, even by my own family. And so, you know, as you grow up and you hit puberty and this sort of thing, and I began to exercise and very heavily, and then I became more fit. But then when I went to college and medical school and in practice, I could see that my weight was beginning to become a problem again. So I did what everybody else did at the time. I dieted, I exercised, nothing made a difference.
So that must mean when you interact with patients, you come from a totally understanding place.
I know what society, how they see you. As a child, I still remember these times, and I remember the comments, and I know what the patients are feeling day in and day out.
Yeah.
Someone who's never had this problem just doesn't understand.
That's why it's such an important reminder to stay strong and rise above. And you've helped us remember that today. So thanks so much for your time.
Well, I think the message is to rise above our prejudice and rise above our ignorance.
Well said. Thanks, Doctor.
Thank you.
All right. Well, again, our Rise Above series is highlighting folks right here in our local community who have risen above life's tough challenges. If you know someone who shows what it means to rise above, you can head over to our website, riseabove.net, to nominate and learn more.